What if you reduce the height of the exposed pulp? For too long, people believe it's okay. I have to cut that frown out and cut them all down, the pulp gets exposed. It's not. You expose the pulp, you need to address it. You need to treat it, you need to do partial pulpectomies or whatever the case is at that point in time. Another reason to be careful and not expose.
Extraction.
Yes. So this is the thing. In small animals, you'll see, we talk about extractions and we do lots of them, no issue. In horses, you must be 100% sure that extracting that tooth is the right thing for that horse. And then you have to warn the client that from here on, you are going to have management issues with your horse. It's not a let's take the tooth out and you all know pain. The hooks, we've spoken about the abrasion, jaw length issue, hooks right at the back. And what you must be careful of is remember the mandible runs like this and then it curves up at the back. What is that curve called? Curve of speed. Okay, so now if you look into the horse's mouth from the front and the table of teeth will sit like that, it doesn't mean there's a hook there. The height above the alveolar bone and the gingiva is the same. So be careful to call something a hook just because it sits in the normal angle of the jaw. But if this top arcade protrudes like that, you are bound to get a hook formation there, and you're bound to get a hook formation. You can see similar to that. Okay, so last thing we're going to talk about is extractions. And extractions even before you get to the teeth. In horses, one of the biggest complications is general anesthesia. Have you heard that? We discussed that. Been at OP 26 years. 6 weeks ago, we had our first my case that I was involved in, a horse that stood up and broke his leg. And it stood. So the surgery was successful. The horse is dead. Okay, so clients need to know before you even touch the tooth, if you're going to anesthetize a horse, there is a high risk. And I'll leave that to the anesthetist, but I believe it's upwards of 30% of horses that can damage themselves with. That's why we have the padded induction chambers and all of this. Okay. So it's risky business. Data. That's why, with the advent of newer drug combinations, etc., we try and do a lot of things standing. We already reduced that one risk. Okay. So you will have to decide when a horse presents with whatever tooth problem it has, can I do this standing? Do I have the equipment? Do I have the expertise and I can do this standing? Or will it need to be a knee cup? That is important. That discussion has to be had with the client. So with the rostral premolars, remember we've discussed it previously, difficult to look into a horse's mouth. We don't have all the access. So anything from the commissure of the lips forward, I can probably do as I would do small animals. I'm sure those of you that looked at this picture will know this is a dog, because horses don't have teeth like that. But we can do a mucoperiosteal flap, we can cut the weight bone, we can take out, just like I would do in a dog or a cat. But anything further back, so from the second premolar further back, unless I do a buccotomy to get access, it's going to have to be either intraoral or I will have to go through the maxilla or through the mandible to get to that tooth. So repulsion for many years has been the obvious other choice, that you will make an opening into the maxillary sinus and then put your pin at the base thickness of the tooth, and then while hammering it down, you will force it into the oral cavity. We've gotten a lot better at this. Very seldom do we actually open the sinus these days, unless there's a sinusitis that we need to address. And we will use Steinman pins with a very sharp tip on radiography. Again, these days with digital radiography that we can have at the side of the crush, we can drive those pins in, get them right to the base of the tooth, and then repulse that. Intraoral extractions, again, has become a lot more of an option because of different equipment that are being used and different techniques that are being developed. You have to always keep in mind the temporomandibular joint. I mentioned that previously. You don't want to battle for 2.5 to 3 hours to take out a tooth, and it does take long in the horse. With the horse's mouth forced open and kept open like that. You're going to have to let go, let the horse just close its mouth again, move the blood supply all around the joint, and then you can continue. Complications are big, and I think that's why you have to be sure this is what you want to do, and number two, this is what you must do. If you're not, haven't done a lot of it, if you haven't gone for training to do it, it's probably a good idea to return. So apart from the general anesthesia complications, make sure you remove the right tooth. I told you, removing one tooth is a complication. Removing more than one tooth, it becomes a nightmare. Okay, so you don't want to remove the wrong tooth and then have to go back and remove a second. You sit with a huge defect that you have to try and close. When you remove a tooth, don't just blindly remove it, be happy and go. Take it, let somebody wash it for you, pack that tooth, put it together. Make sure the entire tooth that you can see on a radiograph is there. With the advent of digital radiography that most practices have these days, make sure that you take follow-up radiographs, just to be sure everything is out of that socket. A bigger hammer is not always the answer. You can break things. Okay, so be careful to not break jaws, especially if there's been long-standing pathology, long-standing infection. The jaw is not going to be as strong as it's supposed to be, and if you just apply the correct amount of force in the wrong direction, you're going to break it. And that is a real complication to do jaw fracture. Chronic sinusitis, I've mentioned that a few times. It is a nightmare. Once you have chronic sinusitis, deal with the tooth, but then to clear up that infection as well. It may take quite a bit of rinsing. And sometimes, I don't know if you dealt with sinusitis before an ATQ. Okay, so the treatment often is to put drains in there and flush them on a daily basis. And maybe that these horses stand in the hospital for 2 weeks, flushing the sinuses. And the horse in a hospital where there's other horses that get other diseases, you just run the risk of them eventually picking up something that they shouldn't. Oronasal fistula formation or orosinus fistula formation that happens. That is why you get these sinusitis. And when we take out this tooth, we have to plug that hole. Because the whole premise behind taking out a tooth is you want the blood clot to fall there. We'll talk about that when we do small animals. And that blood clot is going to help fill that alveolus